Greetings to all of our AACP members, friends, and visitors. Today we have the pleasure and honor of hosting Dr. Daniel Klauer and Dr. Shab Krish. So the format for today will begin with a brief introduction from Dr. Krish and the feature presentation from Dr. Klauer, and ultimately concluded with a Q&A question and answer session moderated by myself. So if throughout the presentation anybody has any questions, feel free to submit them to the chat box to your right or in the Q&A section, and they'll be read aloud. And so without further ado, I'd like to introduce Dr. Krish.
Good afternoon, and welcome to the American Academy of Craniofacial Pain webinar on how to stay relevant and resilient today and into the future by Dr. Daniel Klauer. I'm Dr. Shab Krish. Before we begin, I would like to remind you to register for the webinar on April the 15th for teledentistry. AACP will be providing more learning opportunities in the future. For your convenience, these webinars are recorded and available on our YouTube channel. For more information on coronavirus, you can go to the forum on AACFP website. It's my pleasure to welcome my colleague and friend, Dr. Daniel Klauer. After graduating from the Ohio State University Dental School, Dr. Klauer has limited his practice to treating patients with craniofacial pain, TMD, and sleep disorders. When Daniel is not busy at his TMJ and Sleep Center, he is busy speaking and consulting with several practices all over the country. So here's Dr. Daniel Klauer. Daniel, you're on.
Thanks, Shab. So I'm going to just pass this over and should be good to go. Well, thanks everyone for chiming in. I know I appreciate everyone's time and hope get a lot of good information from this. And so I will get right to it. So this is my Papa Klauer in the middle. He's a dentist. He practiced for 50 years standing up, believe it or not. And he's was doing a lot of this work out in the 70s and 80s. And my father on the picture there is a physician. And so dentistry, I guess, skipped a generation in our family, but he was way ahead of his time. You know, he was wearing gloves before other people and doing a lot of this TMJ stuff. And so what's interesting is that's not what drew me to it. I got into it kind of independently, and then I got an appreciation for what he did. But in my waiting room, he put together a book, and this is like a little book, and it has pictures of patients all the way through it. And so I just included one thing here, which I thought was really, really interesting. This is a patient of his from back in the day, and if you look here, she went and saw someone for a pinched nerve in her neck. She went and saw someone for sinus infections and drainage. She went and saw someone who told her nothing was wrong, and she went and saw someone who said, oh, it's possibly migraine. And so this is 1984, and I have her before and after pictures of what he did for her, and he made her an overlay partial that got rid of her symptoms. And she's 29 years old. So it's kind of cool is back in 1984, he was doing what I'm doing today with much, much less information. So we have this out in our waiting room here just to kind of showcase that, you know, this is pretty evident stuff. It's not necessarily dramatically new, but there's a different take on it. And so here's just another case I wanted to put in, I was looking at this morning. And so this is a kid with virtually 100% overbite that he treated with all functional appliances orthopedically. And it's tough to see, but you can see how much his profile change improved, and then also how much his bite was able to open up through orthopedic development. And so it's just cool. At 95 years old, I can talk shop with my grandfather about this stuff. And when he sees a cone beam and he sees a JVA and he sees the laser, he probably is thinking, oh, wow, you have it easy with all these tools that I didn't have for these patients. But the binder is really cool. I've brought it to a couple CE events before just to show some docs. And I've seen some doctors that I've heard lectures from. He was at their lectures back in the day. So it's kind of cool. And so I lead with that, in that, share your story with your patients, share what motivates you, what's driven you to do this stuff, because a lot of people will find it interesting and they want to know. So I want to make sure you guys, okay. So Shab, interrupt me if you can't see me or the slides, but I think we're good to go. So I'm going to keep rolling.
Will do.
All good, great. So this is my family. So my beautiful wife, she's a dental hygienist. We've never practiced together, never worked together. We work together, but just not, not practice-wise. And we have 4 kids. We have a 7, 5, 4, and 2-year-old. And so she's the true hero, especially now while I'm working every day still on stuff. She's kind of on lockdown mode with the kids, doing the homeschooling and everything. So just a couple of disclosures. So I do have a consulting company where we consult people on implementing best business practices and marketing and stuff like that into the TMJ and sleep setting, and some general dental ortho stuff too. I'm a consultant for dental imaging technologies. I'll give some lectures and webinars for them about imaging. I'm not receiving an honorarium for this webinar, and this is what I do and how I do it. These are my thoughts and opinions, not necessarily that of the AACP or anything. So objectives today, they were listed on the flyer, but really the overriding objective is to leave the webinar with some ideas, energy, and excitement. And I think we all could use some energy and excitement given the times. So we here are 100% fee-for-service office. We do courtesy medical bill. So we have a medical billing company that we work with that does all of the courtesy billing. And so there's a nice separation of church and state in our office, where we aren't the ones waiting on hold and trying to get insurance verification. We don't even collect insurance cards when a patient checks in at the office. We want to focus on the patient and what we feel we need to do to get them where they want to go. And not that we want to be ignorant of insurance. We don't want that to muddy the waters with what we want to do for the patient. So we kind of routinely say cost is only an issue in the absence of value. So at the end of any case I do or treatment, I want to make sure that the patient could look me in the eye and I could look them in the eye and they feel that they got value out of what was done. I think doing this now 7 years, if that wasn't the case, I don't think we would have the reputation or be as busy as we are, because in an area like ours of 100,000 people, word would get out if we weren't consistently getting results. And I also tell patients, if we're not at the end of treatment, if we're not where you want to be, it's usually one of 2 reasons. Either we misdiagnosed you, or something new came up, or you weren't able to be compliant with our treatment recommendations. So if you have a good treatment plan, a good exam, and ever you get to an impasse, go back to your diagnosis and your treatment recommendations, see if everything was followed. And I say that in being able to be compliant, not necessarily saying, oh, a bad patient, they weren't being compliant, because sometimes it is a lot that people have to do. Sleep studies, nasal evals, ortho, stuff like that. So sometimes they aren't able to be compliant within what you thought, 3 to 6 months. Sometimes it does take longer. So we always want to be very clear and transparent with the patients. So I'm a full-time clinician, so I see patients Monday through Wednesday, and we see about 35 to 50 patients a day. About 35 to 50 cases per month is what it usually comes down to. And myself, we have 1 nurse practitioner. She sees patients Tuesday through Friday. We've sent her to get training in craniofacial pain, TMD, sleep, and such. We have 1 myofunctional therapist, 1.5 really, and then we have 5 clinical assistants, 4 admin, and 1 kind of practice development, culture, etc. in the office. And we'll welcome about 60 to 75 new patients a month. So usually I'll see 5 or 6 new patients a day that I'm in clinic in the practice. So it just depends if we see, I don't know, 12 or 16 days of patients, depending on the month. Just to kind of show you, this is where we started in 2014. Worked out of 2 rooms with 2 assistants, and that's kind of what the flow looked like. And that's what a lot of people always ask is, how does the schedule kind of pan out? And this is a more typical day where we'll schedule 5 rooms, and nurse practitioner sees a lot of the progress appointments, managed care type stuff, reviewing sleep studies and whatnot. And I'll tend to see majority, almost all of the new patients and stuff like that, and do all the injections. She's going to go get some training and injections, but right now I'm doing them all. And so a day like this, we were able to get 6 new patients, start 5 cases, delivered 8 cases, recalls, progresses, and appliance adjustments. And so it allows me about a good 2 hours. The patient's in the chair about 2 hours, and so I'm in the room about 15-minute increments, I bet I would say. But it's been working out pretty well like that. So here's our office. We're kind of in a strip mall. There's a restaurant, furniture store, and we are going to be building a new office, but that's kind of the location now to give you some context. And waiting room, we can do some small seminars in there. We have ICAT. Here's what the treatment rooms look like. Pretty simple. We have, just kind of like a doctor's office setup, little sink, and then the monitor here so patients can view their CT scans. And then this room is the only room that has a dental delivery system right in there, so I can sneak that out if I need to have a high-speed handpiece. We have 6 operatories, break room area, and then this is our team at the office. This is Heather, our nurse practitioner, and she's been with us since August. And then we have Crystal, our myofunctional therapist, and then Lauren's also trained as well. And so that's our crew. We're in South Bend, Indiana, so we're 90 miles east of Chicago and kind of somewhat close to Detroit. And then also opening locations in Kalamazoo, about an hour and a half north, and Fort Wayne, about an hour and a half, 2 hours south and east. And so here are my partners in those other 2 endeavors. So Dr. Chad Thorpe right here up in Michigan, and then Dr. Chenoweth, Presser, and Regan. A lot of you may have met them. They've been at a lot of the courses lately in this. And so they have 3 locations in Fort Wayne. And so we're implementing TMJ and sleep out of their practices and partnering on that. And so this is a whole crew. We had a kind of a calibration summit training a few times at our office where we bring everybody in and kind of just get to work and making sure we're all on the same page. So why am I here, and what is my victory? So every patient that comes in our door, we ask what's their victory. We want to know what they want accomplished. And so I think it's only fitting that I know what I want accomplished. And what I want accomplished is that, something like this never happens to someone I know. So this is Christina. Many of you have seen these slides before, but still we're sharing. So she lives down the street from me, grew up with her family, and she had a clicking, popping jaw joint that ultimately turned into this. Now, there's more to the story we can go into and all that, but a lot of us have seen a case like this from the start, and it can go a couple different ways. But what's interesting is her radiology report states that her airway assessment shows very good dimension, and it was commenting on the throat, wasn't commenting on, the fact that she's got a spur there. And so, we see her here and we're wondering, was she predisposed to this? Seeing the mouth open, seeing her fall asleep in awkward places. And I just grabbed these off her Facebook page. And so did something predispose her to that? Potentially. Here she was at a charity event when she had active drainage and swelling. And then now in February, she's got tremendous shift of the maxilla, the hardware is broken down. She's had almost 20 surgeries now, and she still can't open her mouth. And she's amazing. She finished school, graduated from Notre Dame. She works full time, and it's amazing what she does. But my goal is to get to these cases sooner so that it doesn't turn out like that. And she's my sister's age, and so I often think, as empathetic as I can, like I don't want that to happen to someone else kind of under my care in our area. And hindsight, had I been doing this sooner than I did, could we have maybe made a difference? I'm confident that we probably could have, but I'm also not going to belabor that because she's making the most of it. She's shared her story with me, allowed me to share it with others, and she's directly has helped many people along the way by allowing me to share her story. So that's my why. That's my victory. So I kind of went ahead and put together kind of top 10 tips, ideas, things that you guys can be doing. Many of them are fitting given the landscape of going on right now with the coronavirus, but really it's stuff you can do anyways, but now you actually might have time to do it. So I have a lot to cover, so I am just gonna keep on going. So call a doctor a day. So the doctors we work with, give guidance to, I routinely tell them, if you're in the clinic one day, make sure you call a doctor and find a reason to call the doctor. So let's say you have a patient with a profound sinus infection you see on a CBCT, and you want them to do a sinus rinse and see an ENT because they complain of years of sinus congestion, and you know without a doubt an ENT referral is indicated. Pick up the phone, call their primary care doctor who you've never spoken to before, and say, hey, Dr. Kev, this is Dr. Klauer over at the TMJ Sleep Therapy Center. I saw your patient, Michael, and you know, I took an image of his jaw joints, and so when we image the jaw joints, we can see the sinuses, and man, his sinuses look like they're full of bacteria, and he's reporting that he's been on antibiotics multiple times. So I hope it's okay with you, but I was gonna suggest you go see an ear, nose, and throat doctor to have that looked at to find what's going on, and so I just wanted to run that by you and get your thoughts. And if they know you, they'll say, oh my gosh, thank you. If they don't, they'll go, well, wait, who are you? So I'm Dr. Klauer. I just do craniofacial pain and TMD and sleep. And they're like, oh, what do you mean by that? And then you explain to them. And then usually they're less interested in what you decided for the patient because it makes sense, it's clear, and it's obvious. And they want to know more about you. And then it usually goes into, oh my God, well, can I send you patients? And it's like, yeah, no, absolutely. I'd love to see more of your patients. So call the doctor a day. That's how you will know who in the community can be of service to your patients. And then other doctors in the community will know that you can be of service to their patients. So without a doubt, if you're in the clinic, find a reason to call a doctor a day about a patient. Make it an ethical, justifiable, real reason, but just pick up the phone and call them. And then the key would be to get their cell phone number and permission to text them. So the way I end that conversation is I say, hey, Dr. Kev, moving forward, I mean, would it be easier for me to just text you these updates in a HIPAA compliant fashion? Or would you prefer me to call your office, have your nurse give you a message, and then try to coordinate talking to me with my team and everything? Oh, no, here's my cell. Yeah, just text me. This will be easier. And then you can text, as long as you don't have 3 patient identifiers, you could text the doctor, date of birth, initials, or whatever, and just say, hey, I saw Mrs. Jones, you know, we're going to do this. So if you can get on that doctor, that level of texting the doctor, that'll progress your relationship so much further, so much further. And so another idea we just had that we're going to be implementing is a virtual wine and dine. So oftentimes we try to nail a doctor down to get lunch, get dinner, or whatever. Well, what we're going to do is we have a nurse practitioner that still needs to meet some of our doctors. So I'm going to call a restaurant, give them my credit card, send out an invite to 6 doctors, invite them to dinner one night via Zoom. They can call the restaurant that'll deliver the food to their house. We'll drop off a bottle of wine at their house, and we'll host a virtual wine and dine event for our top referring doctors or doctors I want to introduce to my nurse. So we could easily get 8, 9 doctors on a Zoom call. They can eat dinner, have a glass of wine, and we can talk shop without having to leave our house and without having to try to coordinate everybody's schedule. So that's something I think everybody could do, is host a virtual wine and dine event. And to either promote your practice, to learn more about other practices, to learn more, kind of a virtual study club, if you will. So I think there's a lot of good things that can be happening right now if we kind of be proactive. Number 2, to get comfortable public speaking. I just started doing it. I don't think I'm great at it, but I'm comfortable engaging with people and communicating. I feel like I'm much better in smaller groups than in front of a huge audience, but put yourself out there. Look, there's going to be a worse speaker than you out there somewhere, so you probably aren't the worst. That's how I look at it. And so I've had opportunities to have some interviews, watch those interviews, see what my tendencies are, and try to fix them. So do some public speaking, record yourself, get some feedback, find a good, honest friend that's willing to make fun of you and tell you what you might not want to hear but need to hear. So just get as comfortable. You can join some groups, Toastmasters or different clubs in town where you can practice public speaking and such. So, and then there's tons of stuff you can take on slide preparation and how to push out a good message and everything. So definitely, if you want to be more relevant and proactive with getting your message out about what good you can do for patients, you want to get comfortable being out there in the limelight a little bit. So one of the biggest events I've gotten to speak at is the Ormco Forum. There's about 1,000 orthodontists. I did it in 2019 and then got asked to come back in 2020. And so that was from there. And what I did, this video right here, was actually from an event I went to with a company where we did a mock TED Talk. And so what they did was they had 3 professional speakers there, and they video recorded you doing a TED Talk, and then they gave you feedback live from these world-renowned speakers. So it's kind of cool getting feedback from experts on what to do. One guy said, I kicked my feet together when I was talking. I need to not do that. Things like that, got great feedback. So look into those options. Number 3, host events. So probably the biggest event I hosted at the time was in 2017 on transforming a generation. So I was getting frustrated with me recommending this for a kid, and then the pediatrician not being on board, and then the pediatric dentist not being on board. So I got some colleagues. It kind of started with Dr. Boyd. He got Dr. Lagmani. Dr. Evans unfortunately had to cancel, so we had Dr. Lipskus come in. That's just the wrong flyer, I guess. But we brought in about 100 and I think it was 165, 70 dentists, physicians, and nurses. And what was very fitting is this was November 17th. So this was like 2017. This was like a year in the making. Well, that November, this guideline came out on the ADA's policy. And so it was awesome because we had a captive audience of 160 some doctors, and now we could put this recommendation right out in front of them. So the timing worked out beautifully. And so now we've replicated that. We did it in Wichita, Kansas in 2018. And then 2019, we did it in San Jose, and we had a couple hundred. San Jose is the biggest one yet. But what was really cool is Dr. Dwight Damon of the Damon Brackets came, and we got to see patients for a day in Dr. Rabbit's office, a pediatric dentist. And so this is one of the little girls that we saw. I tried to buy her a Notre Dame sweatshirt, but she wouldn't budge. She's a big Trojan fan. But so hosting that one event has just led to multiple different events across the country. And now the next one is going to be in Philadelphia. It was going to be in November of 2020, and we're announcing that we're going to move it to April. We just want to push it out a little bit further so it doesn't hurt attendance. And we got confirmation from all the speakers that they'll do it in 2020. So here's the lineup of speakers we have in 2021 for that event. Dr. Olmos, Dr. Boyd, Dr. Phelps, Dr. Zaghi, and Lagmani. And so we're going to do a day and a half of good content on pediatric airway. So other events we've hosted. So last week, or March 10th, we hosted a workshop on ketosis. So I had a practitioner in town. She has a weight loss clinic, and she uses a lot of ketosis guided medically. And so I got together a room of about 70 doctors, and she talked about the indications for ketosis, how to do it safely, and what a ketogenic diet means and how it was discovered. Really interesting stuff I learned is it's been used for epilepsy for a long time, and in Mayo Clinic, it was part of their treatment regimen for that. And then medications came on the market, and they started to go towards medications versus a ketogenic diet. This is on our Facebook page, so if you want to listen to it, I think it's awesome. Go to our Facebook page, and you can watch the video of Liz giving that CE. So we give out free CE to the doctors that attend, and we just try to pick enticing topics. This is another one we did in November. We did it on musculoskeletal pain. So Dr. Cantiri, who's a osteopathic physician, he does a lot of prolotherapy and osteopathic manipulative treatment and rehab. He gave a lecture on prolo, PRP, stem cell, and PRF. He touched upon all those and their roles in medicine and in steroid injections versus prolo versus PRP indications and all of that. And it was really cool. He gave his time. Those events usually cost us about $500 to $1,000, and we just raise that in sponsorship money. So we contact our bank, any vendors that we use routinely. We'll just say, hey, we're getting a group of doctors together. Would you like to support us? So your supply reps and all of that, just reach out to them and you'd be surprised. They have that in their budget. You just need to plan for it. So we send them a proposal at the beginning of the year. We tell them we're doing 8 of these events. Would you be willing to commit $250 for each event? You can bring someone there. And we have a nice clean menu. We usually do like a fajita bar because that way it appeases vegetarians. It's kind of ketogenic. It's healthy, and just have water. And so it's always well attended, and people like it. Also, other events you can host is let your team run the event. So Crystal, our myofunctional therapist, did a Buteyko breathing workshop, and we streamed it over Facebook Live. And it's been watched a bunch. It's on our Facebook page. And so she basically did that. I had nothing to do with it, didn't need to be a part of it. It was actually on my wife's birthday, so that even made sure I didn't have a part of it. But let your team run the events. Ask them what they think is interesting. Ask them, have your team a good exercise. I'm just going to add this. A good exercise is, hey guys, next week, write down every single question a patient asks you. And then you've just developed your content for what people want to hear. And that's a great exercise because patients ask your team something way different than they ask you. Other events, we let the team pick the topic. So we had a woman in town come in and she just did organization for the mind, body, and spirit. So she talked about organizing your life, organizing your house, and stuff like that. We ask for a $5 donation to a charity we support, Women's Care Center. So that's just when they register, and then we just donate that $5 to, it's optional, but we donate it. And she's a board certified professional organizer. So say yes to less. So that was a good one. Study club. So I was asked to do a study club in November. It was a women's only study club. And Dr. Sim was presumptuous enough to invite himself because I told him I was going to be there. An implant rep connected me with him. I'd never met him. I met him that night. And I said, oh, tell me about your office. He's like, I have a team member of 30. I said, oh, I'd love to come to your office and do that. Do the same presentation for your team. He said, oh my God, that'd be great. So sure enough, 2 months later, went to his office and gave that presentation to his team on a Friday from 3 to 5. So his team worked 8 to 3, and then they all stayed from 3 to 5 to hear this. Not one person complained or was itching to leave. He's got a solid team. It was really cool to see his operation running. He's building a 10,000 square foot office in farm country, west of here. And just a really cool experience. So throw yourself out there. A lot of doctors want to learn more about this and they don't know. And I think a lot of us, especially those on the call, have a lot of good knowledge to share with the community. And if you're passionate about it, it's a lot of fun. So I had a nice opportunity to do that. I did a study club in Fort Wayne where we're opening a second location. So we did that in September. And what I did to mix it up is I brought Dr. Phelps, an orthodontist from San Jose. I asked him to come out and give the lecture with me. So we did a one-day lecture. And so you always want to leave with value. So what can you give the audience that they can take and implement into practice? So this isn't mine. I put it together from different sources. Some questions are from Dr. Olmos, some are Stop Bang and Epworth, but I put it on a sheet of paper to give to physicians' offices. And it really started with Notre Dame when I was doing work with them on how to screen. So I just walk them through how to fill this out and how to ask these questions appropriately and explain what it means to the patient and how to get that filled out in a good fashion so that it's accurate, and then give that to the physician or give that to the patient to say, hey, you should really have a sleep study or you should have a TMD eval. So, when you're going to lecture to like a study club or locally or to a mom's group or to a church, kind of think, okay, how can you have them leave with value? You don't want to overwhelm them or have it be a sales pitch of go come see me, I can help you. That'll happen naturally if you're very giving of your energy and time out into the universe. So also do regional events. So I wanted badly for our local dental society to do a airway event back in 2017, but they didn't. So I just did my own. But then this year they approached me and they said, hey, we want to do an event. would you speak at it? And I thought, well, one better is I'll get my colleagues to speak at it and I'll just moderate it. So we have Dr. Lagmani, Dr. Movahed, Dr. Zaghi, and Dr. Phelps coming out to speak for one day. And I'm going to moderate. And what I'm going to do is I'm going to show one case that each of these doctors indirectly helped me treat. So I'm going to show a case that was purely knowledge I gained from Dr. Lagmani that allowed me to help this patient. Dr. Movahed and I have had a number of cases. I'm going to show a case that he helped me do. Dr. Phelps has helped me with some orthodontic cases, and Dr. Zaghi has helped me with some tongue release cases. So I'm going to intro the speakers by showing a case that, look, this doctor teaching his model allowed me to do that. And anytime I lecture, you know, I always pay homage to TMJ and Sleep Therapy Center, Dr. Olmos, you know, my clinical mentor, and that, you know, without him sharing that knowledge to me, I wouldn't be able to help the people I help. And so we all, the saying is, we all stand on the shoulders of the giants before us. And so I think if we continue to, you know, collaborate, communicate well, we're just going to allow more patients to be helped in this arena. So hosting events, health expos. So this was a tool and die expo. So it's like this manufacturing expo in Amish country near us, and they have this health section. And what we do is very appealing to their mentality of health. And so we get a decent amount of Amish folks. So it's right in the middle of our 3 locations. So we went ahead and got a booth, you know, with, you know, TV in it, and we set it up for this health expo. And I didn't attend this one, my partners did, and they each gave like a little talk at it as well. And so you can do stuff like that. Right when the coronavirus hit, we hosted 2 virtual CEs for doctors in our community. We had over 100 attend on both events. And we did one on ortho and ketosis, and then we did one on myofunctional therapy and oral surgery, and we had great attendance. So that's things you can do. You can host a retreat. So I hosted a retreat 2 years in a row, Mexico and Bahamas. And the one in the Bahamas, or the one in Mexico, the mandate was you had to bring a physician or a dental referral colleague with you. So it fostered bringing another person, and it was basically like it's just a big think tank weekend where we got together. And here's the group from Mexico on the bottom. We just got together to talk shop. So in Fort Wayne, we brought 2 orthodontists that we're starting to collaborate with, and it was great because Dr. Phelps was there from San Jose, who gets it. Dr. Boyd from Chicago was there. He gets it. He was able to talk to these kind of fresh eyes and ears orthodontists that didn't quite get it but wanted to get it. And so it was just great synergy. And so you guys can do these things. You can host these events. I just hosted a mastermind session Tuesday and today from 10 to 2. So these are docs that we were on talking shop and getting thoughts together. Number 4, give back. So local sports teams. So we kind of weaseled our way into Notre Dame through some contacts and some relationships and asking good questions. And so we do the mouth guards for the football team, the women's lacrosse, women's basketball, hockey. And so we go in, and I don't charge them for my time. I just charge them for our materials and what my team rate is. So basically my team gets paid their hourly rate for going there and any materials we use. And then they have a deal with the lab directly. So my time is 100% donated. But it's a lot of fun doing that. And I've had the opportunity to get to know those physicians really well. Kelly's Cares Foundation is a cancer foundation, and the Women's Care Center. So get involved in those, something that you're passionate about, immerse your team in that, and be a part of it. Give back. Here is Valley Christian. Dr. Phelps organized with Dr. Damon and Dr. Boyd. We're basically developing we're going to be developing a software app where the teachers can 3D scan a child's face, and we'll have some craniofacial growth markers to notice any discrepancies that may warrant an exam. And then we're going to have a pop-up of sleep screening questionnaires. So you all know this, but just like you screen for vision and speech and hearing at school, we should also screen for sleep and breathing. So Dr. Damon already wrote a big check to fund that project. And then the president, who's back of the head, is right here. And Danny Kim, who's a very successful business technology guy, they're already on it. They have students developing the software, and then Dr. Boyd, Dr. Phelps, and I are kind of helping to see that to fruition. At my son's school, I went in and did 8 myofunctional therapy Buteyko breathing exercises with the first grade class. And so we're going to start rolling it out into kindergarten, first and second grade next year as part of the curriculum. And this is how it can work. This was great. So this was my son's e-learning 2 weeks ago. And this is the only time I did e-learning with him. He's only been doing it 2 weeks, but this time I did it. And so I go to his first section, and this is his first grade teacher. And this is how she started off the section. And I was just so impressed because she's mixed it into the curriculum without skipping a beat. So I'm going to play this video for you guys to watch.
But not least, before you start your work this morning, I want us to go ahead and quiet our brain, quiet our heart, and we're going to practice some of our breathing that Dr. Klauer always works with us with, okay? Because when you're breathing through your nose and not your mouth, you've got more oxygen coming to your brain, and you're smarter, and you can get your work done better. So here we go. I want you to close your eyes. Put one hand on your heart, one hand on your belly. You can't see mine, but that's where my hand is. And your mouth is gently closed, and you're breathing nice and gentle and slow and quiet as you can. In through your nose, out through your nose, in and out. If your nose feels a little stuffy, what could you do this morning to help clear it out? You're right. Unblock your nose. How do you do that? I want you to go ahead and try it. I know all of you know how because we've done it so many times in school. And I think this is a perfect day if you can teach someone in your house how to unblock their nose. That would be a great activity to start your day, okay? But everyone else, I just want you focusing on your nice, slow and gentle breathing. Unblock your nose if you need to. What are some other activities you could do for your breathing today? You could do some paces while you're plugging your nose. You could do your tongue suction in the top of your mouth like this. Remember that sound? You could do your tongue surfboard like this. Anything else like that to focus on breathing through your nose.
So that's all stuff we can be doing in our communities with our knowledge. Number 5, write something, get published, volunteer your knowledge. So Orthodontic Practice asked me to write an article on myofunctional therapy. And so you can see right here, I wrote myofunctional therapy plays a key role, and just showed one case, and it's gotten me, I think I have a slide, 4 times now they've interviewed me about that same article as it relates to what's going on. So they interviewed our myofunctional therapist. She was on the news twice about it. And this was just, I wrote that article in 2017, but in 2020, they contacted us and we brought the girl back in with her mom, who's a nurse, and they did like a little vignette story on it that you can find online. And so Dr. Olmos wrote this. We co-treated this patient, and I actually showed her Christina's case because she was considering jaw surgery, and we were able to treat her. We co-treated her when he was down at Tennessee and she was in Mississippi, so I was the closest for her to see versus going to California. But Dr. Olmos wrote it and on the case, and it's just as a case workup. So you guys all have this stuff, so get it published. And then in 2018, wrote a book called Achieve Your Victory. And so basically it's 10 patient cases explaining what we do, the diagnosis, and it's written for the patient, but it's also written for a dentist that might want to learn more or a doctor that might want to learn more about what we do. So we have a delivery method of it where we deliver it to every new patient before they come. If they're coming within a week, we'll send them the chapter. The chapters are written by the most common chief complaints I get. So if their chief complaint is trigeminal neuralgia, we send them the trigeminal neuralgia chapter. If their chief complaint's snoring, we send them that chapter. And so we laid out the book to speak to the patients. And so Dr. Phelps in San Jose bought, I don't know, 200, had me sign them, and he gave them out to his patients to kind of get them primed before they came into his office. So I encourage you to do that. You can, number 6, consider a practice website and a personal brand website. And so when we did the book, we kind of set up a personal brand website to kind of set up that side of the coin versus the practice side of the coin. I want the practice to be more about the practice and less about me. because as patients come in, I want them to be comfortable seeing the providers at our office, whether it be my assistant, my myofunctional therapist, my nurse practitioner. So right now, our nurse practitioner is calling our patients, doing progresses and all that. And she probably talks to 20 patients a day right now, and I talk to maybe 1 or 2, except when I'm doing the new patient consults. So that's definitely something I would encourage you guys to consider. Utilization of video. I could probably use video way more than we are, and we're going to be using it way more moving forward. And we got some cool ideas that I'm going to share with you here. But here's a great example of how easy it was to shoot a video that explains a situation for a patient. So you might be in a situation where a patient presents like this, and you're wondering, do you recommend she go see an ENT, and does the ENT fix it or not fix it? She had 0 nasal symptoms, and so these are her words as to what happened via our referral.
This is Andrea. She agreed to send you this quick message. But Andrea, tell me about, from your first appointment, we told you your nose was blocked, and then you got it fixed in June. How does it feel?
3 days after the surgery, I can breathe. Like, I had no idea that I couldn't breathe before the surgery. It was amazing.
Did you think I was a little nuts when I told you couldn't breathe through your nose?
A little bit, yeah.
Yeah, okay, cool.
So there, she kind of admitted that she had no idea. She had no pain afterwards, and she felt great. So 7 again, video. So after this whole coronavirus thing hit, we set up virtual consultations. So I've been seeing new patients virtually, screening them, and if it's bad enough or they're going to go to the ER, I've come in and seen a few. But really what I'm trying to do is just engage with them so that once we're back up and running, we don't skip a beat. So we did this video and sent it out to patients.
Hi, Dr. Daniel Klauer here with the TMJ Sleep Therapy Center. I wanted to shoot this quick video to say hi for one, but 2, also talk to you about your new patient consultation that's coming up. So in this new patient consultation, you'll get the same experience that we get when you're in the office. We can just do it virtually given the time and the situation that we're in. We know that patients' pain and sleep problems aren't going to go away on their own, and so we want to be able to be a resource for you in this time of need and get those problems addressed so that when we are back up and running, we can be more efficient with your care and you kind of know where you're going with everything. So with that, my team will send you some information, and it's really, really important that the new patient paperwork is filled out as complete as possible prior to the appointment. That way we have all the information at hand. Second, we're also going to send you a link, and that link will send you to a portal that allows us to see each other. So you can go to your smartphone or your email, and you just click the link, and we'll be able to see each other face to face. That way, if I have any video demonstrations or things I want to look at or show you, we'll be able to communicate more effectively. The platform works really, really well. In worst case scenario, I have a cell phone, you have a cell phone or a landline, and we just talk over the phone. But the virtual platform has been working pretty well. So it's called doc.c.me, and my team will send you the information on that. So when you get the text message or the email, you'll just click, enter your name in there, and then it'll pop right out. My team and myself will be able to see you for the consult. Really, all you need to do in preparation for the appointment is complete the paperwork, send it back to Jillian, and then log in on the link that we'll send you at your appointment time. I look forward to meeting you and helping you find a way to improve your pain or sleep problems, and I hope you have a great day. Thanks.
So that just takes a few minutes and you can do. Next video we're doing next week is our top FAQs. I am so comfortable talking about why we're out of network with patients, but when you have it in paper, look how many words this is. And so what we're going to do is I'm just going to shoot these in 1-minute video increments to say, you know, the top questions we get. Why are you out of network? Do you take my insurance? What does treatment cost? So every step of the way, I'm totally transparent with patients now, way more transparent than I say transparent. We're always transparent, but I bring up money before they can bring up money because I don't want it to be a point of contention. So I typically tell patients like, look, if I choose to do an exam on you, the exam could be $700 to $900. Our patients find they get immense value from that. And if you're a candidate for treatment, if you're lucky enough to be a candidate for treatment, you could spend anywhere from $3,000 to $8,000 on treatment, depending upon your care and what's needed. So I'm always giving them a range so that they don't have sticker shock. And then get patient testimonials. This is one that we did earlier this year.
My name is Terry, and over a year ago.
I don't need to have you watch it. You've all seen them, but it's just a video format of her care. And then take those videos and put it into a book for your waiting room. So you can have a book with patient testimonials written down. So people in the lobby, they don't need to read all of them, but they see a book dated from that year. The one I showed you was 2017, but do one every year or every other year. Get them, build them online for, I don't know, 20 bucks, get 3 copies and put them in the lobby, and you're good to go. So make them into a waiting room book. Another thing you can do, which most of us don't do, is ask for referrals. We make it so awkward. We make it way more awkward than it needs to be. And if you feel awkward doing it, it's going to come across awkward. So you should probably do practice. So here's Rocco's case. Some of you may have seen this case. It was a lateral kind of open bite myo combination case. It's a bunch of dentists, so we'll show some teeth. But here you can see his open bite, treated him without brackets or braces or orthodontic appliances, and got his bite to close. He had apnea and a nasal obstruction. Symptoms improved, posture uprighted, felt great, headaches gone, and he feels great. So the 2 questions we ask a patient at this point in time, Rocco's chief complaint, let's say, was headache. Just say, hey, Rocco, do you know anyone who suffers from headaches or sleep issues? So you want to ask, do you know anyone? And even one better, say, who do you know that suffers from headaches and sleep issues? Because if he says yes here, then you go, oh, well, who is that? So it's even better to say, hey, Rocco, who do you know that suffers from sleep and headache issues? And then he says, my mom. Would you be willing to introduce us to them so we can give them the same relief we've given you? If you've just helped someone and you ask them for a favor, they're probably going to say yes. So in Rocco's case, it turned into mom, dad, uncle, sister, son, daughter, nephew, and best friend. And so that's often how it goes. So one patient turned into referring 8 by asking a simple question. And now we've had the opportunity to serve 8 more people. Rocco's line now to his family members, because it took him a while to get in. He says, if you love yourself, you'll go in and see Dr. Klauer, and he'll tell you if you need anything from him. And so we've seen some of his other family members who didn't need us. We just got them in front of the right person. But his mom had chronic morning headaches that are now gone. His dad snored like crazy and was breaking teeth. He's on a CPAP and an appliance. His uncle has behavioral disorders and had a traumatic birth and was breaking his teeth. His sister would wake up sweating and have to change the sheets every night. So all this stuff is now a lot better from that. So patient communication system. So maximize those. We have a lot of good platforms. This is just one we use. We use a medical-based software called Health Fusion Next Gen. It works for us, but there's not a great communicator within that system. So we got Doctable on top of that. And what Doctable does is it does some reputation management where you can see the reviews. It also has an easy platform to send appointment reminders. And this is what my team loves the best is it's a shared messenger system that anybody can log into and update live. So we can type out, hey Shab, can you attend an appointment Monday? We had an opening at 2, and I'll text it to her. And another team member can then just pick up that thread right where it's left off. And it's not this whole, oh, Jillian called me. Oh, she's not available. I'll have Jillian call you back. And then Jillian calls back and you're not available. So doing it via this patient communicator tool, every admin person can log in and see it, and they see who touched it last. And so you can pick up right where someone left off. With the whole coronavirus thing, this was a lifesaver because we could have one employee that could just send out a message to 10 people at a time and fill appointment slots pretty quickly. So maximize your patient communication systems for sure. Make it easy for the patient. So if everybody takes out their phone right now, go to as long as you have somewhat of a newer phone, go to your camera and hover over just one of the QR codes. If you hover over one, it'll have a link that pops up and you click on that link. I'm going to do it here. And you click on that link, it'll take you right to my page on Google, and you guys can all leave a 5-star review for watching this presentation. And I have 137 reviews, so we'll see if you guys do that or not. And then you could also go to Facebook, QR code, do the same thing, and it links you right to the Facebook page. So we have that on these business review cards that we give to patients, and their appointment reminders on one side. So even though we really don't need paper appointment reminders because everybody puts it in their phone, it gives them the opportunity, and you ask them to leave you a 5-star review and say those words. Say, you know, we'd love for you to leave us a 5-star review. And then they can. So make it easy for the patients, stuff like that. I got that from my orthodontist. He gave it to me. We do these patient, how am I in time? 10 minutes, okay. We do these patient review summaries. So patients leave with a depiction of what's going on. This guy can now show his wife why he spent $900 to figure out why his jaw hurts and why he wakes up with a dry mouth and has all these issues. Now he can go home and tell his wife, this is what I have, these were my problems. And so we give them kind of a report card and a summary of findings. We give them a normal anatomy page. And so then their diagnosis is put here, and then their personalized treatment plan. And this is our process. You're gonna meet us, we're gonna eval you, we're gonna get to the root of the issue, we're gonna have regular visits to get you through care, and then coordinate it with our network of trusted providers. So that's our process, that's our way of seeing you as a patient. We utilize this, we deploy it differently. So if a patient accepts treatment, they leave with that summary. If they don't accept treatment, I then shoot a video explaining it again, because if someone doesn't accept treatment, it could be that they didn't understand everything or they wanted it explained further. So then what I'll do is we'll send this to them later, but I'll do a video. And that video, I'm just explaining to them what's in the information that we're mailing to them or emailing to them. So I walk through what their diagnosis was, what we discussed, what your treatment options are. So any family member that wasn't able to come to the eval gets to see me in person explaining their disease, their dysfunction, and what we're gonna do. So I usually keep those videos to about 2 minutes, keep it very high level, but always invite them to come back in. And so we use it as a way to reactivate our patients. Because look, anything I recommend, I feel is not optional. So if someone doesn't start treatment, I take that seriously, because I really don't recommend stuff that's optional in our line of work. So I'm very confident and comfortable doing that. So some people would say, Daniel, I just don't have time, otherwise I would. If you need to free up your time, this is a great exercise to do. It's called Delegate and Elevate. So on one piece of paper, write down everything you do every day, from taking out the trash, turning the lights on in the office, sterilization, taking the trash out, shoveling the drive, raking the leaves, whatever it is. Write everything down that you do, both personally and professionally. And then take that list and put it into one of these 4 boxes. And basically anything you don't like gets delegated off to someone else, even if you're good at it. So if you don't like it, but you're good at it, delegate it because you don't like it. If you don't like it and you're not good at it, well, that's the first thing to delegate. And anything that you love and you're great at, or you like and you're good at, keep. So all your tasks put into one of these 4 quadrants, and then anything on the bottom, delegate off to someone. And that'll free you up, that'll give you more time. Now we do have time, but I think a lot of us are realizing we're actually busy trying to catch up with a lot of stuff. Leadership and management. So this is a workshop I did. Leadership plus management equals accountability. So with leadership, you want to make sure you're giving clear direction. Are you providing the necessary tools? So I said, no, I wasn't giving my time and attention to the team. I needed to give them more time. But then I was good at letting go of the mind. I felt I had the greater good in mind always in my actions, and taking clarity breaks. So I have a group I get together with once a quarter to talk about things and business and all of that. So I feel as that. And on the management side, I was terrible. I was 0 for 5. My expectations, I wasn't making very clear. I think this was 2 years ago. Communicating well, I felt like I wasn't communicating well. Always didn't know what was going on in the office. So speed equals trust. So the more you trust each other, the faster things happen, and vice versa. Quarterly conversations, I wasn't having meeting points with my team as much, and I wasn't giving quick feedback, positive or negative. So if someone does something wrong, the sooner you tell them, the less time emotions have to conjure up. So if you do something like this, people can't hide in the model. If you have good leadership and good management, it equals accountability. So orthodontist just said in a webinar I was on, watch closely right now. Notice those who are bringing your team up and those who are bringing them down, because at the end of this crisis, you will have the pick of the litter. So some smart orthodontist, I don't know who said it, don't remember, basically saying right now, watch your team closely. Those who are bringing people down, get rid of, because you're going to have plenty of people to hire and employ, because a lot of offices aren't going to be at full capacity after this. Dr. Abernathy, in a webinar I listened to, said that he expects dental unemployment to be 60% after this is over. And he says he hopes he's wrong, and that's his opinion, but that's what he feels is going on. So does your team know your expectations, and are they clear and visible? So just these are quick slides. We have our mission statement right when you walk in, so people know what the mission statement is. Our core values are posted in the hallway so patients and the team can see. So we have our core values of the practice that are so that if anybody is out of line or doesn't do anything, you can go right to the and point, say, hey, does this embody integrity and authenticity? Because I feel like that action didn't. It's not personal then. It's just this is how we operate. Do you have an accountability chart? So we have an accountability chart in our office that everybody knows what their seat on the bus is. And so we don't hire a person because we like them. We hire a person because they fit the seat on the bus and we like them. It needs to be both. You can't just hire everyone you like, otherwise it won't work out. So this is our office's accountability chart and everybody's roles and expectations. How do you hold them accountable? So we have a proven process manual at our office. So this is the admin process. It's 47 pages. It has phone communication, posting mail, day end process, canceled cases, all that stuff. What's the process for it? So we have a process for someone calling in saying, hey, I don't want to start treatment. I already paid. I want to cancel the case. So we have a process for that so that we don't have to rally up and decide what to do. The marketing and business development book is 50 pages long on processes for that. And then the clinical protocols of housekeeping, Cheerios calibration, ICAT calibration, beam readers, taking a cone beam, autoclave, that's only 29 pages. So it's kind of ironic how in depth the other ones are. But then how do we hold them accountable for that? Well, we have a certification board in the lab with magnets. And so each assistant gets certified on their duties and we know where they're at. So Drea is not certified at pouring up models because we don't really pour up a lot and she just doesn't do it. And she's a new assistant, so she's never really taken a lot of alginate impressions. So that's okay. But this kind of maps out where everybody's at. Paige is relatively new. And so you see here, she's still got some efficiencies to accomplish. So do you know what your team wants? So each team member has a dream board. So we kind of know what their goals, aspirations, and things in life that they want to accomplish. And then it's not, if it's work, it's not work if you love it. So if you love what you do and the team loves what they do, it doesn't feel like work all the time. So a quote I heard this morning is from Chick-fil-A, but I translated it to our world. Your patients will never be bigger fans of your practice than your team. So your team needs to be your biggest cheerleader. They need to be happy and you need to take care of them, because if they're not happy, you can't expect your patients to love you and your office more than your team does. And that's the Chick-fil-A philosophy, and I definitely think that rings true. So you got to develop your regional team. You got to host events. You got to communicate, and these are the different providers in our community that we work with all the time: physicians, nurses, dentists, pediatric dentist, oral surgeon. This is our regional team. There's many more, but these are the people probably communicate with the most. And so you must have a non-clinical plan to carry out all of your clinical knowledge. And that's the biggest thing that I see people missing is they take 5 implant courses and they still have never placed an implant. And they think taking one more implant course is going to get them to start doing it. And it's like, no, start placing some implants and then take more courses. And so you got to start doing it at some point. Otherwise, you're going to lose that knowledge. If you're interested in reading more, email Heather hbishop@tmjsleepindiana.com, and she'll mail you a copy of these books. And then if you want, my email's on the bottom. I can give you, email me, we can give you a copy of these slides and everything. And so my closing thoughts are, sometimes you'll watch someone do something like bracket a case or carry out treatment, and it looks so smooth. It kind of looks like this. Yeah. So that's my cousin barefooting. Looks really good, looks really easy. So I thought, you know what, I'll just go out and do it and give it a try. So I figured I'd just try to emulate him. You know, you put the suits on. It's okay. And down he goes. So you'll survive. Someone will turn the boat around, come back and pick you up. You'll have bruises up and down your leg for a couple weeks, but my advice is just get out there and try it and do it. And the worst thing you can do is you might need help from someone along the way. So with that, we'll open it up to questions. There's my email. If you do want a copy of the slides, shoot it to me, or I can send them to AACP and they can blast them out to you guys. So I'll take some questions.
Yeah, it looks like we got time for one question here, but it is about one of the first things that you showed us about the total joint replacement case. I guess it's more related to the specifics of it. So the question was, could you share more about it? I really want to know, how did you manage the case? I saw that she had orthognathic surgery, and I maybe think she developed condylar resorption afterwards. And I just want to know what we could have done for her to avoid this from happening.
In my opinion, I didn't treat her. I just saw her along the way. In my opinion, if she would have had her nasal breathing addressed before they did the first arthrocentesis, probably wouldn't be in that position. But that, you know, hindsight's 2020. But so she had arthrocentesis. She had BSSO, bisagittal split osteotomy, and then she had discs removed with fat grafts, and then she had fat grafts removed with new fat grafts, and then she had joint replacement with a maxillary mandibular repositioning, and then both joints got infected, got replaced. So I mean, I could show you for an hour all the slides I have on that, but basically it could have been managed. I don't think it should have ended up that way, but a lot of people inherited a really tough case along the way. So it's not like it's on one doctor. I think it's on us as a community for not knowing how to best triage and treat that type of patient from the start.
Yeah. So I think that pretty much concludes our time that we do have. Dr. Klauer, appreciate you going in depth on best ways to improve your practice, as well as grow not only within the community but also those connections. Gained a lot of valuable knowledge, and thank you for all the AACP members who were able to jump in on this. We'll be sending out some recordings of this video, as well as additional resources, and Dr. Klauer will definitely be CCing him on any additional information that people reach out to. So
if there's any questions, you can email them to me, and I'll get you responses on them. So if there's any more questions, just let me know.
Yes, sir. All right. Well, we appreciate your time again. Thanks again so much.
All right. Thanks, everyone. Have a great day.
We'll see you.